Thank you very much for the warm welcome. I worked in the NHS for 20 years, and initially as a healthcare professional, but about 5 years later, I moved into the area where we focus on safeguarding health and social care records, data protection and privacy. So this morning, I'm going to come to you in two parts. In the first part, I'm going to cover what is in your health and care record, what is health and care data, and after your table discussion, I'll come back and talk to you about the safeguards that protect your health and care data. So I think I was listening to the conversations you were having at the tables, and many people actually understand that there is not a single health and care record for an individual. So in essence, health and care data is a collection of notes that your doctors or other care professionals take while they're looking after you. And also, very importantly, doctors don't work on their own in the health and care services. They are supported by various health and care professionals. So your health and care data doesn't always come from your doctors, but they may be coming from a nurse looking after you, an occupational therapist, a counselor who will be contributing to that record. So every provider, such as your GP, will actually hold information about your health and care. They will collect that information mostly from you. These will be notes of the information they provide to you. The notes are never verbatim. They will always summarize things like your background, your family history, but also they will have a record of your test results and x-rays and correspondence that actually goes between different providers. So as you can see here, every individual will end up with multiple records that relate to their health and care. You will have a record that will hold your information when you go to the GP. You will have a record when you go to A&E department in the hospital. If you go to another hospital, also the hospital will have your health and care data. Health and care records have various purposes, but the most important thing that helps you and care professionals is that they're very important tools for communication. So often, for example, you're staying in a hospital on a ward, that particular shift's staff will make notes so that the following shift will actually know what's happened to you in the previous one. Or your doctor, who may be transferring your care to another specialist, will write to that doctor to share your information about them. That's our expectation, isn't it? Because when you travel to see different specialists, your information should travel with you. Sadly, the reality isn't as ideal. We would all hope to have single record that would be visible to a doctor or a nurse or a counselor so that you don't keep repeating yourself. And you don't always have the chance of repeating yourself. For example, you may be unconscious when you see a doctor, sadly. You may be at an A&E department. You may have a relative who's having a stroke who will not be able to repeat their previous medications and their treatments. So sadly, the health and care records have a fragmented structure, very much like the fragmented structure of our NHS. Although we look at the NHS as a single body, many of us know that actually there are different providers, there are different hospitals that keep that information separately. But the information to be shared will only be useful for the doctors, nurses, and people looking after you, and also for your care if that information actually flows effectively with relevant safeguards. Now, I'm going to stop here for a table discussion, and then I will come back a bit later on to talk to you about those safeguards on health and care data.